Hi viewers, this is Dr. Muhammad Iftikhar Islam from Pakistan. Today I am going to present my lecture on hemorrhagic fever, which is caused by hantavirus. Hantaviruses belonging to genus Hantavirus family Bunia variety are a group of antigenically distinct RNA viruses carried in rodents and insectivores, shrews, and moles. Each hantavirus is endemic in one or at most a few specific rodent or insectivores host to which it is well adapted. At least 20 hantaviruses have been identified, but estimates of the exact number of the viruses vary. In humans, the consequences of infection depend with the virus. Different hantaviruses cause hemorrhagic fever with renal syndrome and hantavirus pulmonary syndrome, the two syndromes seen in humans. Hantavirus associated disease was first reported in the United States in 1990s during an outbreak in the Four Corners region. Several young and healthy members of Navajo Nation in New Mexico presented to the Indian Health Service physicians with a sudden onset of respiratory failure in May 1993, and by June, 12 people had died. The Department of Public Health for New Mexico, along with the Centers of Disease Control and Prevention, became involved and set up surveillance and testing. Nearly 1,700 small mammals representing 31 species were subsequently captured and tested. Almost half of the mammals captured were deer, and 30% had antibodies to virus named Cinnomber virus. Often, rodent urine droppings or nests are distributed in enclosed areas. The viruses are then inhaled in aerosolized dust. Infection can sometimes occur after only a few minutes of exposure to the aerosolized virus. Hantavirus can also be transmitted through broken skin, the conjunctiva, and other mucous membranes by rodent bites and possibly by the ingestion. However, data suggesting the possibility of hantavirus transmission in breast milk have been reported from the South America. Person to person spread has not been seen in hydropericardium syndrome cases in North America, but occurs in occasionally with Andes virus in Argentina. The severity of hemorrhagic fever with renal syndrome varies with the causative agent. Huntan, Dobrava, and Amur virus infections usually cause severe symptoms. Seoul virus generally results in more moderate disease, while Pumala and Sarima, which is also called as Dobrava virus infections, are typically mild. Classically, the course of the disease has been divided into febrile, hypotensive, or proteinuric, oliguric, diuretic, and convalescent stages. These stages are usually more evident in severe disease and may not be seen in mild cases. Onset of hemorrhagic fever with renal syndrome is usually abrupt. The initial clinical signs may include fever, chills, prostration, headache, and backache. Gastrointestinal signs, including nausea, vomiting, and abdominal pain, may also be seen. In some cases, the pain can be severe enough to mimic the appendicitis. Patients may also develop injected mucous membranes, photophobia, temporary visual impairment, a flushed face and conjunctiva, or a petechial rash, which usually occurs on the palate or trunk. This prodromal stage typically lasts for a few days to a week and is followed by the onset of renal signs. The first stage is proteinuric stage. Hypotension may develop during this phase of the disease and can last for hours or days. Nausea and vomiting often occur, and the death may result from acute shock. In severe cases, this is typically followed by an oliguric phase, then a diuretic or polyuric phase as kidney function improves. Death can occur at any point. A definitive diagnosis can be made if hantavirus is isolated from the patient. However, the recovery is not always successful. In addition, some hantaviruses, including Cinnabar virus, have never been isolated in cell culture. If viruses are found, they can be identified by virus neutralization. Hantavirus infections are often diagnosed by serology, either the presence of specific antibody in acute phase A sera or a rise in antibody titer is diagnostic. Serological tests include immunofluorescent antibody test, enzyme-linked immunosorbent assays or ELISA, immunoblotting, and virus neutralization. Commercial ELISA or immunoblot assay kits have been developed for Dobrava, Huntan, Pumala, Sol, and Cinnabar, and some other viruses. Hantaviruses can cross react in some serological assays. Supportive care is the mainstay of the treatment. Intensive care may be required. Ribavirin may be helpful in cases of hemorrhagic fever with renal syndrome, but has not been effective for HPS to date. Hantaviruses are found naturally in various species of rodents and insectivores. Each virus is thought to be carried mainly by one species of animal. However, sometimes a species can carry more than one hantavirus, and some hantaviruses may infect more than one host. The infection rate varies between the sites and over the time, but in some cases, up to 50% of a rodent population can be seropositive. On average, approximately 10% of deer mice are seropositive for Cinnabar virus. Hantaviruses can be carried lifelong and are not usually associated with overt disease in their reservoir host. However, studies have been reported decreased survival in bank voles, Myodes glarulus, infected with the Pumala virus, and deer mice infected with Cinnabar virus, as well as lower weight gains in infected male deer mice. Hamsters infected with Andes virus may develop fatal pulmonary disease similar to the HPS. Hantavirus infections can also kill neonatal rodents. Hantavirus infections can be prevented by avoiding exposure to the rodents and their excretions. Many cases of hydroperitoneum syndrome and hemorrhagic fever with renal syndrome occur after living or working in an enclosed rodent infested space. However, some patients have reported no known contact with the rodents or their feces. Hemorrhagic fever with renal syndrome has also been associated with agriculture activities such as harvesting crops or working with hay. Well, that's the end of today's lecture. Thank you so much.